Hello, I'm Helen and I'm a Programme Manager at Down Syndrome International. On behalf of everyone at Down Syndrome International, I would like to thank you for joining us today. As you know, this year's theme for World Down Syndrome Day is about what inclusion means. This session is focusing on what inclusion means in health. The UNCRPD says people with Down syndrome and disabilities have the right to good healthcare, the same healthcare as everyone else, and make their own choices. These rights are outlined in Articles 3 and 25 of the UNCRPD and in the Constitution of the World Health Organization. For these rights to be upheld, it will require changes in society and in health practices and systems. These changes will need to ensure that environmental factors such as cultural attitudes, laws and policies, services, and the accessibility available do not present barriers to the inclusion of people with Down syndrome and intellectual disabilities. On a practical level, for people with Down syndrome and intellectual disabilities to have the same access to comprehensive and quality healthcare will mean expanding healthcare services, programs, and research to cover all people, especially people with disabilities. Mean having information about healthcare in accessible formats so everyone can understand it. It'll mean having health consultations that are accessible and welcoming to everyone. It'll mean focusing on the health needs of each person and not on the fact they have Down syndrome or a disability, an issue called diagnostic overshadowing. It'll mean including individuals in discussions about their personal health and then giving the necessary time and support to make their own choices if they're able to do so. It'll mean providing healthcare professionals with training on how to provide the necessary support for people with Down syndrome and intellectual disabilities, and also with the knowledge about health conditions that may commonly affect them. Much needs to be done to achieve inclusion in health. It will require talking to all key stakeholders involved in legislation and health practices and services. More importantly, however, any discussions and future plans must fully involve people with intellectual disabilities and Down syndrome from the outset to ensure that future healthcare will be truly inclusive and will meet their needs. Again, to quote the slogan contained in General Comment number 7 of the UNCRPD, nothing about us without us. This will take time and small steps. In this session of the conference today, important work towards achieving this vision is showcased. Thank you.